Hi, my name is Siobhan Hall. I will be one of the students in this course. I just want to talk a little bit about the questions or requirements that you asked. So my education history, I started out as a STNA. I was a STNA for 7 years, and then I went to school to get my LPN and my RN. I started out in the emergency department as a LPN, and then I went to work agency where I visited a lot of SNFs, short-term rehab centers, detox centers. I did worked in on a hospice unit for almost a year before I transitioned into my current role as an RN. I had a short stay in critical care, and where I'm currently working at is a trauma med-surg floor at a level 1 trauma hospital here in Cleveland, Ohio. As I prepare a patient for labs or diagnostics tests, I just explain to them, print out an education packet, let them know, what the diagnostic test or labs are for, ask if they have any questions. I also try to include family at the time. If they are an older adult, or if they may have dementia or Alzheimer's, I usually try to have family involved in care as much as possible to do education. So like if a patient is going down for a CT scan, because we do see a lot of falls, I usually just explain what a CT is, why they're going down for it, what are some things that they can expect, and then after, what are things that they can expect. And let's see. The type of nurse practitioner program that I am in is the adult GERI primary care. In this role, a nurse practitioner can work in a SNF, assisted living, rehabs, hospitals. I feel like the biggest challenge for me would be transitioning into the nurse practitioner role. There are a lot of responsibilities, and when diagnosing or managing care for a patient who may have a complex history, I feel like that would be a challenge for me. And just trying to look at the patient as a whole and not just like as a bedside nurse, we're just looking at orders sometimes and doing, small or dressing changes, passing medications, suggesting these things, hanging fluids. But as a nurse practitioner, I am over the entire plan of care with a patient, so I have to be very detailed in things that I am doing for my patient. So I think that would be the biggest challenge for me transitioning into this role. Thank you guys for listening to this video. I hope that we have a great time for these next 6 weeks in this course. Thank you.